Happy Tuesday, everyone. Welcome home. So glad to have you with me. As always, I've got a great lineup for you. We've got a jam-packed show. Today, we are starting with the story of self-reliance. Africa is doubling down on innovation in this moment. We are leaning on ourselves to find African-led solutions to the problems that are emerging with this pandemic. In just a few minutes, I'm going to be bringing you the very best and the latest of Africa's tech breakthroughs with a journalist from the UK. So stay with us for that. Plus, Africa's governments are doing their very best to grapple with this pandemic and the secondary problems that are emerging alongside with it. The scale of the problems are almost too many, too great to grapple with, to fathom. So they need help, and individuals are stepping up to fill the gap. In just a few moments, Toyin, Saraki, philanthropist and entrepreneur from Nigeria, will join us to share how she is stepping up in this moment to make a difference in this crisis. And have you heard the story about how drinking bleach will cure you of coronavirus? Have you heard that one? Yeah, you know exactly what I'm talking about. The lies, the misinformation, the deliberate untruths that are circulating around coronavirus and COVID-19, they are dangerous. We are going to be tackling them today here on this show, one by one. So go ahead. Start writing in, start sending in your questions, every myth, every rumor, every idea you've heard around coronavirus and COVID-19, send them in to me. We're going to have an expert in the house who's going to break them down one by one. We're only dealing with the facts, nothing more. I want to hear from you. I told you it was a busy day. Let's jump right in.
Animation, Thomas.
Well, this pandemic is a catastrophe that has catapulted the entire world into a whole new dimension. In Africa, alongside the crisis, also comes something of an opportunity for African-led solutions, African-created answers to our own problems, which keep Africa front and center. These innovations are playing a key role in the fight against coronavirus and COVID-19. And these breakthroughs, I'm talking about scientific, I'm talking about medical, I'm talking about every realm, these breakthroughs that are emerging aren't just benefiting Africa, they're also being exported to other parts of the world. In other words, lessons are being learned from Africa. So we want to dig into this. We want to get a sense of what is happening, the pace of innovation, the pace of the breakthrough. I'm so pleased to say we're joined now by journalist Ashionye Ogene. She's a global business reporter and anchor with BBC World News. She joins us now from London. It's her first time on the show. Ashionye, welcome.
Hello, Aisha. Good to be here.
It is so good to have you with us. So, just help us understand this moment. Like I just said, yes, it is a crisis, undoubtedly, but there's also an opportunity, one that we're seeing is being fulfilled in Africa in terms of breakthroughs and innovation.
Definitely. I think, most of the discussion that's being had in relation to Africa and their response to COVID is one which isn't really looking at necessarily what's happening on the ground. It's what's looking at what could happen potentially. I think it's really important to focus on what's being done here and now for people to feel, confident and safe, but for people to also be positive, because there's a lot of negativity around at the moment, really.
Yeah, no, I agree. There is. And I think you make a really good point. When I read the articles, and they're not that many talking about Africa and this pandemic, and I say globally, if I sit down, if anyone is at their computer, sit down and put in Africa coronavirus and see, comparatively how few articles there are. And when you look at those articles, by and large, it's all like, the world is ending. Africans are going to die by their millions. Yeah. It is catastrophic.
Yeah.
That's not to deny what worst case scenario could happen, God forbid, but it's not talking about what is happening right now, which is the moves that are being made to tackle it. What is happening right now?
Yeah, well, from my experience with some of the companies that I've met along the way, and I'm a global business reporter, and, I've been traveling across Africa and meeting loads of people who are doing very interesting, very innovative things. And I think some of the companies that come to mind, there's a company like called 54Gene in Nigeria. They are a biotech startup, and they are famous for building Africa's first commercial DNA biobank. And now the importance of that, there's an importance in that in relation to healthcare, not only for Africa, but for the world. So if you look at the African genome, so African DNA is the most genetically diverse in the world, but currently it only makes up about 2% of scientific material which is being used for research. Now at the moment, the world is looking for a vaccine for COVID-19, but doesn't have access to the full pool of scientific data and information which would be able to kind of help in relation to that. Now that's kind of looking at the future of what's possible, but in terms of what they're doing now, they are basically they've been able to create mobile testing labs which are going across the country, which are helping people to get faster diagnosis. They've raised a ton of money, and even on the subject of testing, you can think about Senegal, which have been in the headlines. For doing incredible stuff. I mean, they've found $1 testing for COVID-19. They're also kind of using methods which are not necessarily being employed across the rest of the world, which are working in the continent, using things such as like chloroquine for patients. And then, other companies which are using like things like logistics companies, which are really important for us to basically be pushing at the moment now, because if you look at the supply chains, supply routes have been massively affected, ports have been massively affected. Across a lot of the continent, people are relying on goods which are imported. So now is a really crucial time for the continent, for people to be able to rely on what we can, do at home and kind of get across the country as well.
I mean, having the breakthroughs be created and scaled up and distributed by Africans, I mean, what does that mean for this fight long term, specifically this pandemic?
I mean, long term, I think what I've kind of thought about what's important, and long term is important because Africa needs to be a part of this battle because it's a global pandemic. We're all impacted. But we also need to kind of look at those local solutions, because those what will work in some parts of the world isn't going to work everywhere, and so in terms of kind of finding like solutions that are going to work for everybody, we need to have Africa as part of that conversation, those innovations, those solutions, because the more of us that have got contribution, the better.
Yeah. And in terms of shifting narratives, what's your sense as you're there in the UK, you cover world news, what's your sense of the willingness to tell this story of the innovations and the breakthroughs that are taking place in Africa? Not to discount the challenges, those are real. The threats, the hurdles, what this pandemic could mean for the continent, nobody's discounting that. But this other side of the story that happens at the same time, what's your take on that?
Well, it's an interesting question. It's that you put it that way, because, I mean, I'm in the UK at the moment, and that's because we've been grounded, we're under lockdown. But typically, I would constantly be out traveling across the continent. It's very rare that I'd actually be at home. And what that kind of gives me is a perspective into how people are perceiving this crisis and how, attitudes towards it. From what I can see, there's just two very different conversations that are being had. And I just think it's really crucial and that's what's so fantastic about the show as well, that we're having these conversations on here. But it definitely does seem to be very different conversations that are being had from, this. We're not seeing the full picture, and it's important that we see the full picture from medical breakthroughs, science, innovation, so that we can kind of have a fuller picture of what we're battling and how we can battle it.
I think my question is why? Why aren't we getting a fuller picture? I mean, from the spaces that you're traveling in, why is it that even in this moment there's a kind of a resistance to move away from certain narratives around the continent?
I guess I'll just be real with you. I mean, there are a couple of reasons for that. One is access.
Mm-hmm.
A lot of the media has been restricted in terms of movement, but then also I think it can also be down to just condescension. People can be quite patronizing when it comes to Africa, and it's like people are kind of, whether it's from an editor to the public, there is a story which they're used to being told. There's a story which they understand. And sometimes they can be presented with a story which is the complete opposite, a story of innovation, a story, and there's an almost disbelief.
That's so true.
A guy in a white lab coat in England or the US, and it can't be true. What have we got to learn from these countries who are recording lower cases and who are recording good results, lots, but then if it's not credited by a World Health Organization type body, which is not to discount because it's important, we do need to make sure that we are not putting out things which don't have scientific, reliable, accurate basis. But I mean, the short answer to that question is, I think it's attitudes, and it's attitudes which need to change, and which will only really change through exposure. So the more of those stories that are coming out, the more people are exposed to what's happening on the ground, by who and how, then they'll be more accepting of it. But aside from those people who aren't accepting, it's also important for people who have a desire and an interest to also, access it.
Yeah, no, I think that's true. And I wanted to turn that question on its head and say, as much as we're talking about attitudes externally beyond the continent, and maybe an unwillingness to kind of shift away from old ideas, what about on the continent itself in terms of the spread of information about these breakthroughs? Of course, because I tend to find sometimes that even we don't know the great things we are doing on the continent.
Yeah. I mean, social media, and that's one thing that we are great at. So people are sharing, people are hearing more about what's happening through social media. But I guess, there are downsides to that also in terms of inaccurate information that's being shared. But when it comes to innovation, when it comes to startups, when it comes to, those kind of stories, I think that word of mouth, social media, people like to share good news. People like to share things which they're not used to hearing. And that is a way in which people are learning more about it.
Yeah, no, these are important stories. Ashionye Ogene joining us there from London. Thank you so much for shining a light on these breakthroughs that are happening on the continent. These are stories that need to be told. So thank you for championing them.
Thank you very much.
Thank you. Be safe. Thank you.
Bye-bye.
Listen, we want to tell these stories. We want to share these stories about the breakthroughs that are happening, whether it's, this burst in telemedicine that we're seeing, whether it's apps that are being created in some parts of the continent that are helping farmers get their produce to market, or even get produce directly taken to people's doors because they can't leave their homes if they're under lockdown. It's absolutely critical that we share the fact that, as difficult as this moment is and the challenges and problems that we face, that there is an effort to find solutions, and those efforts are being led in many cases on the continent by Africans. And you might say, well, what does it matter if it's an African that's coming up with a solution versus, a European or a Westerner? It does matter, because given their origin of being from the continent and knowing it, they understand the nuances and they understand the different contexts and the different factors that need to be taken into account as they build these solutions, which makes them more durable, which makes them more effective. So it's absolutely important that we are at the table, and that, again, wherever it is in the world that solutions are being formed, that breakthroughs are happening, that Africans are part of that conversation, so that we are included and we're considered a priority in terms of the rollout, in terms of the design. So I think that was a really important conversation to have with Ashionye there, and it's one that we're going to continue throughout the weeks here on Home with Isha Sesay. You've already started writing in, and I want to say thank you. Thank you so much for everybody who has written. I'm going to try and scroll to the very top. You've already started sending in questions for our expert as we myth bust later on in the show, all those myths and all those rumors and the misinformation around coronavirus. We're tackling that later on in the show, so please stay with us for that and send your questions in. We have guests, we have viewers, you are my guests, coming in from everywhere. Lots of people just saying hello, people from Uxbridge, London, Adejo, to David, hello, thank you. Sarah Macaulay is with us, Mustafa Touré, and James Simbo has written in, a whole group of people. I want to say thank you to each and every one of you that has written in already. Please keep your comments coming. And again, those myths, those questions you have around coronavirus, send them in. We're going to be tackling each one of them here on the show today. Moving on. The scale of the challenges posed by this pandemic are mind-boggling. I mean, they are almost too great to grapple with. There is the health crisis, and then there are all these second and third tier problems that come with it. So there's a health crisis, there's an economic crisis, and there's the questions are huge. No one government can deal with it on their own. I mean, it's just not possible, and they need help. They need all the help they can get. And so at this moment in time, it is absolutely critical to have individuals, private sector stepping up and forming these partnerships with governments to help them with resources, to help them with expertise, to help them coordinate this crisis as it unfolds. I'm so pleased that we're joined now by someone who has dedicated many, many years of her life to helping find solutions to enduring problems in society. Toyin Saraki is a global health advocate. She's a philanthropist and the founder of the Wellbeing Foundation Africa. She joins us now from London. Toyin, welcome.
Thank you very much, Aisha. Nice to see you. And,
nice to see you too.
Happy to see you looking healthy too.
I'm locked up, Toyin. There's nowhere to go. I'm keeping away from everybody.
We all are.
Yeah, I hope you're well and everything is good with you. I really want to dive into the work you are doing in this moment. You haven't skipped a beat. You've got the foundation, and now you have pivoted to help in this effort to share information, for people to get the information they need to decide whether or not they need a test or whether they need to self-isolate. Talk to me about your platform.
Well, the thing is, as you know, the Wellbeing Foundation was actually founded upon health records because I felt it's very, very empowering to have access to your own health information. And when the COVID started, there were so many questions around the world and around the continent, and I needed to find a way to reach people so that they had an accurate way to have questions answered. And what we actually did was the Wellbeing Foundation partnered with Pocket Patient MD. And Pocket Patient MD is a platform that connects medical providers to their patients and also allows them to access their electronic records. So we got together to actually design a COVID self-check. As you know, we're all in isolation, and people need to be empowered to, first of all, know the symptoms, to check themselves, to know that, yes, COVID feels like flu, but you need to be able to distinguish what is just a regular flu and what is COVID. So the platform we designed, it's free, it's accessible to all, and it allows you to go through a series of questions. Now, it's not completely unique. There are many, many platforms in many countries, but because I have the Wellbeing Foundation, our platform will also actually have an area for pregnant women, and it guides you through questions. It tells you if you're high risk, and if you are high risk, it helps you to connect to the public health authorities. So we give advice, we give information, and we also give that very swift referral to public health authorities. We designed it because we wanted, first of all, to get every Nigerian self-checking while they're in lockdown at home, but also to be able to provide the information on the hotspots, to be able to provide some predictive information as well to the public health authorities. We've been very, very fortunate. We've worked closely with the government from the start. We have the endorsement of the NCDC, the CACOVID, the WHO in Nigeria. And I think it's really a first point self-check, self-triage that allows people to measure the standard of what they're feeling and get the help they need.
So let me ask you this. They take the check, and I want to make an apology to anyone if there's some audio coming through while you were speaking, Toyin. So I just want to make sure we're mindful of that. If people take the check on your platform,
yes,
and they need to go and get a test, like it comes back and they say, there's a situation here, you need to go and get a test. Are the tests available for people to access? Because I certainly know here in the United States, I couldn't just pop up and say I need a test, and I couldn't get it easily. What's the situation in Nigeria now?
The NCDC, I believe, has tested over 8,000 Nigerians. And I believe that they're using a very similar protocol that is being used around the world. So for the first month, they were testing people who showed symptoms, who had a record of contact with a positive COVID case, and who also had a travel history. I would like to see mass testing. I believe that the best way to make use of this lockdown is not just the lockdown for infection prevention and control, but also a lockdown to allow testing to reach people in their homes. The evidence we're seeing about COVID shows that even if you have had COVID and recovered, it doesn't mean you're immune to catching COVID again. So we really, around the world, not just at home in Nigeria, we need to find a mechanism for repeated testing, which people can drive by themselves. I personally think this would possibly be the rapid testing. So the first thing you do is you self-triage through your series of questions. If you look as if you're some sort of high risk, apart from calling the isolation center, calling the NCDC, I would like to see governments send tests to people in their homes where they can actually take a reliable test, show if they're positive or not.
What's stopping Nigeria from, mounting the kind of robust testing that we've seen in somewhere like South Africa?
Well, first
or even
of all,
Ghana. Where we've seen door-to-door testing, and what's stopping Nigeria?
We need to acknowledge that most mass programs are driven from a primary level, from primary health level. Our primary health system is weak. We do not have enough primary health care centers across the country, and those we have varying degrees of efficiency. I believe, and I would like to think, that COVID is a wake-up call for us to act immediately to strengthen health systems for regular health care, because it's only when your baseline is strong that you have the resilience to be able to react to an emergency. So the NCDC is doing everything it can. The Presidential Task Force on COVID is doing everything it can. But we need to rebuild that social contract with the people, so that Nigeria is going to need its citizens to meet the government halfway, but in their homes, in safety, with isolation, with infection prevention and control, to actually bridge that gap. I can't see us responding, say, in the next 2 weeks to mass testing, but I believe that emergency legislation should take place. If we can legislate for emergency lockdowns and we can legislate for quarantines, we should be able to legislate for mass testing as well. These are key investments that need to be made. As of today, I believe we have over 1,000, 1,337 confirmed cases. And this is since our first reported index case. We've had 40 deaths and we have 255 recoveries. So if you look at the total number of people who have been tested and those who have been discharged, and you consider that our population is supposed to be 200 million, we're scratching just the surface.
You're barely scratching. I've got to ask you, because, as I hear you speak so plainly about the need to understand the urgency of investment here for mass testing and making the right moves to get a handle on the situation. And you made the very accurate point that, if you can make the legislation, if you can pass emergency legislation for quarantine and all the rest of it, you can take these extra steps. I'm intrigued as to your thoughts or your response to the facts that have emerged in recent weeks that the countries that have female leaders have fared the best to date in this fight against coronavirus and COVID-19. So New Zealand, Germany, some Scandinavian countries. I mean, what do you make of that?
I think what I make of that personally as a woman is that women tend to think things through in a lot more detail. Women, because we run homes as part of our DNA, it's, to nurture is within our DNA. So we take very practical solutions to things. And sometimes the solutions a woman will apply will look like such a simple solution, but these solutions work. If you look at 2018, when I saw some data that showed me that only 4% of health facilities actually had water and soap, and I immediately started a wash campaign for hand hygiene. Now that was based on historical evidence and current evidence. I think it was 1840 that Ignaz Semmelweis discovered that in his maternity clinic, that the midwives that were washing their hands, the moms were not having childbed fever, as they called it then. He was hounded out of the medical profession because, how dare a doctor say that, female midwives are better. But look at it for COVID, hand hygiene and the extension to respiratory hygiene, environmental hygiene, surface hygiene, that has been the answer. Who would have thought that in 2020, it's going to be hand washing and wiping a surface? But so women, we tend to remember and we tend to be practical. It does not surprise me in the least that the countries that have been led by women are the ones that are actually having very swift responses that are practical and bringing the level of disease down. This is what women do. I hope that the men will meet us equally on an equal table and realize that some of these solutions that we present that look so simple have huge impact.
I want to pick up on, you mentioned midwives and maternal and infant mortality and the challenges around there. You're also working in this area during this pandemic. What are the goals here? What are the targets?
Well, the thing is, I was very worried at the beginning of the pandemic that pregnant women, the one thing that doesn't wait for anything and not even a pandemic is pregnancy. But so many hospitals are being devoted, obviously, because of the huge quantities of COVID infection. So I was very worried that pregnant women would not be able to access the care that they so clearly need. When you're pregnant, especially in a low and middle income country, the WHO recommends that you should have 8 antenatal visits, throughout your pregnancy and for your postnatal visit. And so women were actually being denied access, to their regular routine care because of the challenges of COVID. I've been very happy to see many countries actually come out and make statements that primary care continues, your pregnancy antenatal continues. And in places where women are worried because of the worry of infection, we have actually started giving online antenatal classes as far as we can do. The WhatsApp groups have been extremely useful. I'm on the WhatsApp groups with my 45 midwives and the questions are nonstop. But it's really important to know that a pregnant woman and a nursing mother, a recently delivered woman, still has the right to the right quality of care from a qualified midwife, whether or not there is COVID. The WHO has said that a pregnant woman is not at higher risk at catching COVID from a regular person who's not pregnant. But we also recognize that COVID is a highly transmissible disease. So it's actually important for pregnant women to take those extra measures of hand hygiene, respiratory hygiene, household hygiene, wear your mask, but you can still breastfeed. I tend not to separate the health of the mother from the health of her newborn because they've been exposed to the same.
That's right.
And it's just important, even nutrition, it's important to get that access to care and to continually self-check. I think the one thing COVID has shown us is it has completely changed the relationship between health caregivers and patient. or if you felt ill, you go to the doctor tells you what to do. Now, because of infection prevention and control, you are your own primary caregiver. You have to check yourself, you have to report yourself, and I think governments need to meet individuals halfway in that.
Yeah, Toyin, Saraki, so good to have you with us, and to get your insights into what more needs to be done and the efforts you have underway right now. Thank you for your work. Please be safe, and we'll check in with you again.
Thank you very much. Thank you.
All right. Well, lots of messages coming in already. Coming in from all over the place, and lots of different comments coming in asking about the virus. Again, we're going to be getting to those specific questions a little later on. We have a doctor in the house. We're just getting him set up. We're going to get his take on these myths, and he's going to share the facts, because I think it's absolutely critical that we get to the facts. We want to separate fact from fiction. And so I want to thank you all for writing in. Anita Kumba Nyandemo, thanks for bringing the information to us. Bramason Jusu has sent in a question. I'm going to get it to the doctor. So many questions here. So in fact, why don't we just bring the doctor in? Because there's so many questions here. We just want to get going rather than go through them ahead of time, because we want to make sure we have enough time to get through everything. So let's shift gears now, and let's talk about the issue around information, accurate information in this pandemic. We have seen a surge in misinformation, disinformation, which is the deliberate attempt to deceive, to confuse, to cause panic in some cases. That is also at play. This information is popping up across social media. It's on different groups. It's on Facebook. It's on Twitter. It's on Instagram. It's, it's everywhere. Certainly, that's the impression one gets. And I know that, and you know that the social media groups, the tech companies are struggling to keep up to remove it in real time so that it doesn't gain traction and spread. But it persists. So here on Home with Isha Sesay, we want to tackle this because we understand that this kind of thing isn't harmless. It is potentially dangerous to have some of these myths in circulation. So we decided that we would grapple with the myths and the dangers. We have a doctor in the house. Let's bring him in. He joins us now. Dr. Yanis Ben Amor is here to walk through some of this with us. Dr. Yanis Ben Amor, welcome.
Thank you so much, Aisha. Good afternoon. Just a quick disclaimer so that people don't get the wrong impression. So I'm not a physician. I'm a molecular biologist. So I'm an expert on viruses and bacteria. I'm also a global health expert, but I'm not a physician. I will, however, be able to answer most of your questions, I hope.
That's okay. And you can just point us to the data that, that doesn't support some of the other things that, may be more medically focused. Okay, so we're going to walk through some of the most commonly shared, spread myths. I want to start with this one around bleach, UV light, hot temperatures. This had kind of been in circulation in disparate form, and then the President of the United States kind of brought them all together in one unholy mess a few days ago, and now it's gained traction that bleach, UV light, hot temperatures have the ability to kill the virus. Lay out the facts for us.
So this is where you have to separate what happens on surfaces and what happens in the body. So all of the agents that you mentioned are true. They are actually killing the virus on surfaces. So if you have a countertop, if you have a kitchen, you can apply bleach, and bleach will kill the virus, as will UV light. Many countries now, Singapore, Taiwan, for example, are using UV lights to sterilize their mass transport at the end of the day, or many times a day, to make sure that when the buses, the subways go back into circulation, that they are sterilized of virus. Hot temperatures will typically also kill the virus. However, it should never be used on the body or inside the body. So let's just go back to the story that you just mentioned with President Trump. I believe it was this past Thursday evening, during the regular coronavirus press coverage or update.
Briefing.
That he was being presented with new information, that bleach and UV and warm weather was killing the virus at a higher rate, let's say under 2 minutes. And so he started musing about the idea, what if we were ingesting this or injecting this to humans? And unfortunately, it had this negative consequence where we've seen a spike in calls from concerned patients to their physicians or to coronavirus hotlines to ask, so should I be doing this? No, you should not. So use bleach to sterilize surfaces, but do not use bleach to wash your hands. Do not drink bleach. Do not inject bleach. This might kill you. UV light is the same thing. It will kill it on surfaces, but don't use it to sterilize yourself. UV light causes cancer in humans. And in fact, if you watched the press conference on Thursday, when he turned over to Debbie Birx, she was quite uncomfortable about suggesting this idea of using UV light to sterilize. Yes.
I want to pick up on two things that you said very quickly there before we move on to the next one. Different, but it's part of the same idea, and I just want you to lay to myth lay to bed as opposed to lay to myth, considering where a lot of our viewers are. This question about hot temperatures, and I'm talking about atmospheric hot temperatures. And, the idea that the virus is moving more slowly in Africa because of the heat. Where is the data on that? What's the standing on that idea?
Okay, so as much as the previous one were myths and false, this right now, the science doesn't know yet. Okay. We have to remember, this is a brand new disease. It's been around in humans for less than 4.5 months. It started spreading around January and really picked up worldwide around March. So the information that we have on this virus is actually quite scarce. We do, however, know that it's part of a group of viruses called the coronaviruses. Everybody knows that. I think it's been widely advertised. And there were other coronaviruses in the past that have created outbreaks relatively long time ago, enough for us to understand how they would react in certain circumstances. The two big examples, of course, are SARS, severe acute respiratory syndrome. The outbreak was 2002, 2003. And then you have MERS, the Middle Eastern respiratory syndrome, which happened in 2012. What we know is that typically coronaviruses are seasonal viruses, meaning that when warmer weather comes, the transmission tends to go down. This was the case with MERS. It was the case with SARS, except that the viruses didn't stick around long enough. They actually disappeared in less than 6 months on Earth in terms of transmission. So what I can tell you is that when we are doing studies in the laboratory using fixed conditions, so high humidity, high temperature, the virus, this one, SARS-CoV-2, doesn't like it. But here is the big problem. Is that it started spreading in countries like Australia and countries like Singapore at a moment where they were in their summer, right? So it spread in Australia in February and March, and in Singapore from January until April, when they are still in their hot and humid conditions. So that's why we don't know. We are praying and hoping that warmer temperatures are going to slow it down. But if you were to ask Tony Fauci, his answer would be the same. We have to wait, and we will see.
Okay. Thank you for clearing that up, because I get that a lot when I speak to my friends in Africa who tell me that it's the heat, will be fine. Next one, drinking alcohol cures COVID-19 infection. Fact or fiction? Total fiction.
In fact, it could make you more sensitive. So let me try to explain, as I'm trying to figure out where these myths are coming from. Again, on a surface outside of the human body, alcohol, particularly high levels of alcohol, right? The ones that you use in the jails to sanitize your hands are more than 70% alcohol, kills the virus almost instantly. So I guess by transition, people would assume if they ingest the alcohol and get the alcohol into their system, it will kill the virus. It's not the case. One of the main reasons is because the virus is airborne into the lungs, and when you ingest it, the alcohol goes into your stomach. not the main reason, but it's one of the reasons. So, however, there is a negative effect in consuming alcohol. It actually decreases your immune system.
Yeah.
So you might think that you're doing something well, when in fact you could make yourself more susceptible to the negative consequences of a virus or any disease, actually.
So let me ask you this, just to jump in, because I have friends who are having the odd glass of wine on an evening. Are you saying, again, just to say, are you saying people should abstain from all alcohol right now? Is that the general guidance? Just so we get because I will tell you, I was at the supermarket a couple of days ago and people were loading up on booze. So I'm just trying to figure out, because everyone's locked up and people are drinking. So what's the guidance?
Yes. No. I am aware, and I apologize for the sound. I am taking this call from home. Obviously, what do people do when they can't socialize outside? They try to make their quarantine a little more livable. So the odd glass, probably not an issue. It's drinking in high quantity with the idea that you want to get sterilized from the inside. That's absolutely not recommended. Okay. Drinking every night, also probably not recommended. But again, I'm not a physician.
People, you hear that. The next one I want to ask you, this one I will say even I did, because I read it somewhere, and I know a lot of people may have heard this one. So this is interesting, and I want your take on it. Fact or fiction? If you can hold your breath for 10 seconds, you have not been infected by coronavirus.
Fiction. Fiction, absolute fiction. So,
and a lot of time doing that, just so you know that.
And so it could actually be harmful. So let me go back to, again, where this could come from. Coronavirus, COVID-19 causes a respiratory illness. One of the main symptoms is a dry cough. So people would assume that their breathing is impaired, which actually it is in the most severe cases, but not everyone is experiencing shortness of breath. There are people, as we now know, that can go completely asymptomatic, or they may have other symptoms like losing smell and taste, but not having respiratory problems. Incidentally, this shows that this virus could have an impact on the brain and not just on the lungs, which is actually quite scary. So the idea of holding the breath for 10 seconds tends to show for people that, okay, my breathing is not impaired. As a result, I do not have COVID. That is not true. There are people, like I said, who are infected with SARS-CoV-2, do not have any breathing issues. They can hold the breath for 10 seconds, but they are still infected. They may be infectious. So that is fiction, Aisha. Okay.
The other one that's out there that's in circulation, fact or fiction? Where is this coming from? Let's lay this to rest. Bill Gates engineered virus causing COVID-19.
Bill Gates could be responsible for all the unfortunate things that are happening in this world. Poor man. When in fact he is really, really trying to help with the fortune that he has. Obviously, he is famous for Microsoft, but he's also famous for the Bill and Melinda Gates Foundation, who are doing really tremendous work worldwide in trying to help eradicate certain diseases like malaria. And so I've actually also seen this go around on Facebook. People assume that because of the work of the Bill and Melinda Gates Foundation and the work that they're trying to do on vaccination, it would make sense for someone like Bill Gates to have engineered the virus in a laboratory to then unleash it onto mankind so that the Bill and Melinda Gates Foundation can invent and distribute the vaccine. So two things about that. And I guess it would also put to rest another myth that's out there, that the fact that it's been engineered.
Yeah, I was about to say that.
It's not.
Yeah.
It's not.
Why are you so sure it wasn't engineered? Just
Okay, so you want the long answer or the short answer?
Short answer, because I've got so many questions for you.
Okay, so the short answer is that there is actually a study coming out of California by Christian Anderson and his team that have looked genotypically at the sequences of this coronavirus, and they were able to show that it has evolved from other coronaviruses like SARS-CoV, the virus that is causing SARS. And so it's not. Right now, the evidence is not there. I think that people like to believe the conspiracy because when such a pandemic hits the world, something that is so uncontrollable, so out of our grasp, people feel probably relieved to assume that there's some kind of design behind it. It makes them feel, even though they don't agree with it, but it probably makes them feel more in control. But it's not the case. It was not engineered in a lab, not in China, not in the United States, and definitely not by Mr. Bill Gates.
Okay, I'm going to just that I get asked a lot. That COVID-19 is spread through 5G networks. We've got to tackle this, because if I tell you, if I got $1 for every time someone said that to me, I would be eating a lot more chocolate.
That would be miraculous. So no, absolutely fiction. So I'm trying to think where the science would be with that. I believe it was in 2011 that there was a study that was published that showed, or tried to show, that bacteria were able to communicate using electromagnetic waves. So that study has been disproven, I believe. And also, COVID-19 is caused by a virus, not by bacteria. So no, absolutely not. Another reason why I think that this theory actually got a little bit of traction is because Wuhan in China, where we think that the virus originated, actually was one of the first cities in China that had a widespread of 5G. But at the same time, so did Beijing, so did Shanghai. And here is a reason why all of your viewers can think for sure it's not, if they don't take my word for it. Iran has very little penetration in 5G, and you see how badly it was affected by the disease.
Yeah, absolutely. This other one that we have, garlic, ginger, and lemon, which I'm a fan of, all those things. And it's out there. Garlic, ginger, and lemon cure COVID-19 infections. Fact or fiction? It's fiction.
So it will not harm you. It probably will give you a boost, but it will cure you from coronavirus, unfortunately. So I have seen, rather unfortunately, the president of Madagascar recently touting an herbal drink using a plant that has apparent anti-malarial properties. And it was developed in Madagascar using other herbal ingredients. And I think it was a week ago that he went on national television and said, okay, this is the cure for coronavirus. No. To this day, unfortunately, there is no cure for coronavirus. WHO is everywhere in the world trying to look for solutions. Never has the scientific community come together as unified as we have in this particular outbreak to try to come up with solutions where it's a vaccine or drugs or new diagnostic tests. Unfortunately, they are just not there. Not hydroxychloroquine, not chloroquine, not remdesivir. These are some of the names that you may have heard of. The clinical trials, unfortunately, are very inconclusive. Garlic, ginger, and lemon. Some of our Kenyan viewers may know that as dawa, at least the ginger and the lemon. Delicious, very effective as a tonic, but unfortunately will not cure coronavirus.
This thing about vitamin C, again, another one that keeps coming up. So as we're talking about, garlic, ginger, and lemon, and the Madagascar president and his statements, let me jump straight to vitamin C. What does the science say? What does the data say? Let's set this to rest once and for all. Does taking high doses of vitamin C protect individuals from contracting coronavirus and getting COVID-19? I've seen videos myself of a doctor, I think he was in China, talking about, taking high doses and the difference it made. What's the truth?
No. So I have not seen conclusive evidence that vitamin C could present a way to prophylactically prevent coronavirus infection. So just like drinking alcohol reduces your immunity or your possible immune response, things like ginger, things like garlic, and things like vitamin C may increase and may boost your immunity, but not to a level where you could be in contact with SARS-CoV-2 and not become sick. It is possible that your immunity might be slightly better and you would be more prepared, but you could still get it and you could still develop severe disease. So definitely not. And I want to tell the viewers, be careful about using high doses of any type of vitamin, particularly vitamin C. High doses of vitamin C, particularly if it's not the natural kind coming out of lemon and oranges, could lead to kidney stones, and you really wouldn't want that.
No. I want to pick up, you mentioned hydroxychloroquine and chloroquine a few moments ago. I grew up in Africa, suffered multiple...
So did I.
Exactly. Okay, so you know where I'm going with this. Multiple bouts of malaria, and chloroquine was given as a kid. I've had this conversation with many people on the continent and beyond, saying that having had malaria, because we're exposed to such high levels of malaria in many parts of the continent, because of that, we are less susceptible to COVID-19. We develop some kind of resistance, some kind of immunity. Fact or fiction?
So before I answer, let me tell you where this is probably coming from. The idea that, this infection that started in China, then moved on to Iran and Italy, then came to the United States, and somehow Africa seems to be preserved, made people start going into all types of conjectures as to why it is that Africans, and to some extent also Indians, seem to be less susceptible. So, no, there is no evidence right now, unfortunately, that having had malaria in the past gives you some kind of immunity to SARS-CoV-2. As far as I have seen, that is not the case. So the association comes from, we need to find a reason why the rates are lower in Africa. One of the reasons could be the number of infectious agents that are going around in Africa. And so people have mounted immunities, and maybe some of this immunity could actually prevent SARS-CoV. There was a similar idea about the tuberculosis vaccine called BCG. I don't know whether you have heard that. There was this idea that countries who were vaccinated, people who were vaccinated were probably protected. And again, this came from the idea that if you looked at the countries who had a very high basically infection rate, like Italy, they never vaccinated, and somehow Africa seemed to be preserved. But again, this is because the infection started in Africa way later than in the rest of the world. And hopefully Africa will not be catching up. There is no reason to believe that this won't be the case. I mean, I am talking with experts in South Africa, in Kenya, in Ghana, and what all of these countries are trying to do right now is to save time, to make sure that the healthcare system is prepared. So the previous speaker on your show was talking about testing. Obviously, that's a very, very important aspect, is to make sure that whenever that wave will hit you, that you will be prepared. And so that's why the social distancing, which is so complicated in the context of Africa, it has to be done as much as possible so that that wave will hit you a little bit later. So right now, no evidence about malaria being protecting or malaria.
I want to jump into some of these questions that we've got, and they've been pouring in. Aya Sodengbe says, can steaming be considered a possible cure? Various victims have stated that it helped them out. This is, again, this whole idea of increasing the heat, the internal heat within the body. Right.
So this goes back to the same idea that bleach and UV, etc. So where this comes from, this idea, is that the body's response to invading agents like bacteria and viruses is to develop a fever. So you go from 37 degrees to 38, 39, because that actually slows the progression of the virus. You cannot, however, create this artificially by taking a steam bath or a hot bath or some of the practices that I have seen, which is where people put a towel over a bassinet of vapor and breathe this in very, very hot steaming water. That could actually burn you. It could burn your eyes. It could burn your nose. So and there is absolutely no evidence. I can tell you none, zero, that this is working. Unfortunately, if it did, you would be seeing steaming baths in all of the hospitals in New York and Europe to try to help the coronavirus patients. Unfortunately, that's not true.
Lots of questions about the temperatures in Africa. We've already addressed that. Thank you to everyone for asking that question. This one question, before I let you go, I've got to ask you, and more, it's not so much a myth per se, but just to speak to its efficacy. Beth Archibald asked this: should we all be wearing masks?
So there has been a flip-flop in the policy, and I can try to explain why. So originally, back in February and March, when we knew less or little about the disease, we didn't realize how infectious it was and that people could actually transmit it completely asymptomatically, which was not the case with SARS. When people were infected with SARS, only when they showed symptom, and they all did, they were infectious. And so it was very easy to pinpoint them and take them into quarantine. With this COVID-19, many people are asymptomatic. So before we knew that, governments realized that if they made everybody wear masks, there was already a shortage worldwide. There was not a country in the world that didn't have a shortage of PPE, including masks. And so telling the population to be using masks would have made that shortage even worse. Mm-hmm. Then, about a month ago, the study came out that you could actually be infectious without showing any symptoms, and that you could infect someone just by talking to them at a very short distance with a limited amount of time. So all of a sudden, wearing a mask became a very good strategy, because if you don't know that you are sick and infectious, if you wear a mask like this one, right, actually creates a barrier between your saliva. When we speak, we project saliva. When we cough, when we sneeze, we project saliva. So this creates a barrier. It's not perfect, but it's better than nothing. And that allows you to not then send those infected particles onto the person who you are talking to. But, similarly, social distancing, being away 2 meters from the next person will also work. So now in New York, you live in New York, Aisha, you've seen it. Most of the people are now wearing the masks. And it's not to protect them. It's to protect others if they were infected and infectious from transmitting it.
Dr. Yanis Benamor, it has been so fantastic spending this time with you. The questions have poured in. I hope that you'll agree to come back regularly, because you know that, as silly as some of these things may seem, they could be potentially quite harmful.
Absolutely.
And everyone is panicked now, and we're all just looking for something to kind of alleviate the fear, to protect ourselves. So, to have your expertise and insight is so amazing, and so grateful.
I would be very happy. And let me just finish on this. If your viewers are finding miracle cures or miracle information on Facebook or other type of social media, if it's too good to be true at this point, let me tell you, it is not true. If you have any doubt about anything, go check a source. Typically, the World Health Organization or any good news media, and I'm not going to tell you which ones, but there are a few that are excellent out there in many countries. Go check. If the information is not there, probably the information is not true. And I can tell you, if somebody is trying to sell you a cure for coronavirus, a vaccine for coronavirus, right now, there aren't any. They're trying to con you.
Yeah,
Aisha.
And hearing those sirens go off is a reminder that these are very difficult days for many. Dr. Yanis Benamor, please be safe. Thank you. And we look forward to welcoming you back very soon.
Thank you so much.
Thank you.
Have a wonderful afternoon. Thank you.
You too. Be safe. I hope you found that informative. I hope you found it information that you can use, information that you can share. Dr. Yanis Benamor is going to be a regular on this program. I'm committing him to coming back. So start writing down those questions. Start writing them down. Start sending them to us. We're going to do another one of these probably next week. We're going to make this, as regularly as he has time. But certainly we're going to aim again for next week to do these fact from fiction, these myth-busting sessions with you. So I just want you to understand that it's important that we give you the information that you can spread, that we share this information in this moment to keep us safe, to keep our community safe. So that's a promise I'm making to you, and that's what we're going to do. I think that was a great way to wrap today's show, but we can't let you go without the bright side, because through all of this, through the fear, through the uncertainty, you hear me say it if you watch regularly, that we've got to find the bright side. We've got to find the ability to laugh, to smile, to hold on to our humanity. If you'd watched yesterday, that the bright side came with a ton of laughter. Today, it comes with effortless cool and some skills that we could all do with having. This man, who will join me in a few moments, knows his way around a kitchen. Take a look.
Peace, y'all. This is your boy Roble. I'm supposed to make a video telling y'all what I've been doing during this whole quarantine mess. I've actually kind of been anti-quarantining. I be out here every day doing the Lord's work. I'm donating a lot of food. I did like 1,300 pounds of food the night before last. Still cleaning up from that. Gonna do it again. Being very creative. A lot of creative cooking. Developing a lot of recipes for my next restaurants. I'm catching up on a whole lot of stuff that's been on the back burner. And I'm actually very much enjoying it. Less people on the streets, you know, and uncrowded New York is enjoyable to me for now. And I'm also very much looking forward to speaking with Aisha on Instagram Live this afternoon. So I will catch y'all later. And yes, I'm being safe. My eyes are on the road. I'm not looking at the camera. So I don't want to hear none of that. So y'all stay safe out there. Be healthy. Peace and love.
I told you it was effortlessly cool. Cooking Rockstar, Chef Roble joins me over on Instagram in just a few minutes. That does it for us here, whether you're watching live on Facebook, Twitter, or on YouTube. Thank you for spending time with me. Thank you for being with Home with Isha Sesay. I'll be back tomorrow at same time, same place. Right now, grab a drink, non-alcoholic, grab a drink, meet me over on Instagram to share with Chef Roble, top of the hour, which is now. See you in a few minutes. Be safe, everyone. Thank you for joining. See you back here tomorrow.